Hello. We're going to go ahead and get started in the interest of time. Apologies for it being a day late. I had a situation I needed to attend to that is non-COVID related. Okay, so just going to get started with some status things. I do have a lot to talk about given the very steep increase in cases and to try to address some of the questions that I know are circulating out there. Okay, so we will be up over 500 cases today easily. I was just doing data entry a few minutes ago because we are very overwhelmed with cases. As you see in the post, there is just no conceivable way that we are going to be able to contact, trace, and investigate all of these cases in a timely manner. Yesterday, I think we reported out 40 new cases. We're getting easily 20 to 30 a day. Sometimes more now. And so, you know, we really have a lot of work to do. And we're working 7 days a week, 12-hour days, and very little staff. And I'm going to talk a little bit about public health capacity in a minute, but we will be over 500. There's still some cases to enter. And that's really counting cases that were reported yesterday evening. So lots of investigation happening today. Obviously that makes the rolling averages go up for the reported cases over the last week. We've had more than 150 cases reported since last Friday at this time, and the positivity rate is around 20%. We do get data from the state for negatives, and then we also have some CDC data for what the state reports to CDC, and they're both around 20% positivity rate, which is significant. I do know, I know there's going to be a question about DOC. 208 cases have been DOC, a part of that 500-ish. There might be some more in this stack over here as we start entering, but you'll see that at the end of the day. And again, I apologize for the delays at the end of the day and getting data out, but there are just so many cases coming in. It really is a full-time job to enter data at this point, and we don't have that type of capacity. So, I had some questions that came in the message box about are these cases that have contacts that are in their homes that are being tested, which is a really good question. Are these connected? So the contact, under mode of transmission, you've got like travel, contact, unknown, and then under investigation. So that contact box is pretty high. It's up over 300. So that means we know that those people were in contact with another positive. The unknown is the ones that have no idea where they got it, have no conceivable idea if they've been in contact with somebody or not. So right now that's at 97. Again, that's based on what I had entered so far today. It'll probably be maybe a little bit different by the end of the day when we update numbers at 4-ish. But, they are going up. I will say that some, of course, are going to be people that are connected or families, household contacts, but a lot of these are just cases coming from different places. There's been a variety of places that we've had this week that we've been investigating. Lots of issues with gatherings, and what we do is contact trace those. So, we've definitely seen some issues with gatherings this week, especially funerals, some churches, things like that. And so, I'll talk about some of the mitigation things that we've talked about time and time again. But it is imperative that people stay home when they're sick. And of course, we do have a 2-day window prior to that they are infectious. And so obviously you can't know that you're sick if you're not sick, but certainly staying home when you're sick is important, and is a huge part of this. And we're seeing a lot of folks in the community that are going out and that are actively ill, and huge risk for transmission. As of right now, again, kind of preemptive data entry. There are 60 cases that are under investigation, waiting to be investigated. I am investigating all day, pretty much. Our nurses are investigating all day, and we're trying to get through them as fast as possible. But these are very time intensive. A case is about 4 hours in the very early stages. So when you first make the call, you do your investigation, you get your contacts, that alone is 4 hours. So 10 cases in a day is somebody's full-time job for the entire week. And, you know, we've been working around the clock for the last 6 months, and, you know, it really is just not possible at this time. We still don't have funding. I have no funding for this response. And I realize that is maybe a little bit confusing, but at this time, I don't have any funding for it. So I do expect that we're going to get funding, which will help. But we've been hiring for a public health nurse for a couple months and still don't have one. And so, you know, there's lots of capacity issues with Missouri's public health system. We're the lowest funded public health in the country. Our state is the lowest funded, and are well below the national average for per capita for public health. And so we're working with very limited capacity and very limited resources. And when we're working doing our best to continue doing this response. But, you know, contact tracing and investigation is extremely important. However, timeliness is huge. So when there's delays in testing results, or, you know, the public health capacity is overwhelmed to the point that we can't investigate in a timely manner, it's going to have an effect on transmission. And then, yeah, I would say, you know, I think I've said this before, but we don't contact trace any disease that is this widespread. You know, the reason why it's so important is because it is causing severe disease. And that kind of brings me to my next point. And I see a lot of questions coming in, and I'm going to try to get to them. But at this point, I've got a lot of stuff to talk to you about. So let's talk about deaths. So, you know, last week we released that we had 2 suspect deaths. Suspect deaths are not typically released. And when I say suspect, I mean, you know, we know they're a positive case, we know they've been sick, and now, you know, there's a death that's been reported by, usually it comes in a medical record to us. That medical record does not certify it as a death. Our requirement by the state of Missouri is that we have a death certificate that lists COVID-19 or SARS-CoV-2 as a significant contributing factor to the death or the cause of death. And so we now have 3 suspect deaths. And the ones that we reported last week, we're still waiting on death certificates for. And so we're kind of at the mercy of the state for that. So talk a little bit about hospital capacity before I move on to the next couple of things. Parkland is getting busier with COVID. They're doing okay right now, but they are keeping a consistent number of folks admitted to the hospital with COVID. So, you know, we are seeing an increase in hospitalizations, and you can see that in our hospitalization number. That number is a cumulative number that we're listing every day on that last slide or last photo, but Parkland is seeing an increase in hospitalizations due to COVID-19. Dr. Kirkley, I do have media calls on Friday. I do with all the local media that can attend, and Dr. Kirkley is doing that with me, and he'll be on again today. And so I think it's really important to hear from us and also hear from our healthcare partners as to, it's really kind of a different piece of this, and to hear about what they're seeing and the capacity that they have. So, you know, usually Daily Journal reports that out, and then also, you know, on the radio. So it is important to hear from them. I want to talk about what the health department's jurisdiction and power is. So getting a lot of questions about stay-at-homes, mask mandates, those types of things. So I just want to be really clear that the health director in a non-chartered county does not have the authority to create rules and ordinances. That is elected officials, and that's who has that power. My job is to enforce or carry out public health policy. And so I just want to speak to that's how that works. So if there's something you're wanting to advocate for or speak about a policy type of change, you know, we can talk about it, and I'm going to talk a little bit about masks for sure. But those things come from that level of government, the elected official. Now, that being said, the health director does have the ability to close public places for an outbreak. And an outbreak in a place has to do with the number of people who are susceptible and the number of people who are infected. And so there's a lot of things wrapped up into that. And, kind of going back to power and authority, just because you have the authority to do something doesn't mean that you should, or you shouldn't. You should always cooperate or work with that entity anyway. So at this time, that's really where we're at. And again, I think there's a lot of confusion because there's a lot of things happening in charter counties, and what a charter county and a non-charter county can do is different by statute. So I think there's some important differences to point out there. Let's talk about masks. So again, getting lots of questions and thoughts about mask mandates. I think I talked about it last live, but unfortunately, the pandemic has been made into a political issue. And again, I think I spoke to it, but the health center is not a partisan entity. Our only goal is the health and wellness of our residents that we serve. And so our elected officials, our Board of Health, they are nonpartisan as well. They do not run as a part of a party. And so for us, it's really not about that. It is about preventing transmission and breaking the transmission of disease so that we can get these counts under control. Because the longer this goes on, the way we're seeing these spikes, it is going to get worse and worse. We are going to continue to see doubling of cases because that's how disease transmission works. Masks are evidence-based. We've talked about it several times. There's been lots of scientific literature out there to show that. There are a ton of questions. I'm going to try to get to them. I see all of them popping up. They are evidence-based. They work to prevent transmission. Again, they're not bulletproof, and I think there's been some articles in the last several days about the testing of different types of masks, but they are a great tool for us to use to prevent transmission in the community. Again, I understand that this is a polarizing issue, and we talked last time about, mask shaming, whether that's wearing it or not wearing it. I've heard both. But we've got to work together. We have to. There's really no option. I think that our community is a caring community. I really believe that all of us don't want to see deaths or people who get really, really sick that could have been prevented. And, the majority of people are going to recover from this disease. That's true. The majority of people are going to have a mild illness and they're going to recover. But there's about 15 to 20% that are going to require hospitalization. And then some of those people are going to require, intensive care. And then some of those people are going to die. And so, I think wearing a mask is a small price to pay to save people's lives. And I realize I might get into some trouble by saying that. But my recommendation is that, we have universal masking. But, the better thing is that for the community to do that, we've seen some, backlash against mandates and, in America in general and, our society, we are individualistic and independent. And those things are all important in what makes, America great. But at this time, I really feel strongly that we've got to work together. And I have been recommending, I will continue to recommend that everyone wears a mask in public places where social distancing is not possible. Again, this will help prevent transmission. And this is a good segue to schools. So I've had a lot of questions about schools. My recommendation to schools, along with Parkland Health Center's recommendation to schools, is that everyone who is age appropriate wears a mask, including staff. That is our recommendation. However, the schools understand their population, they understand the district that they're working in, and obviously they would get some pushback on that, and I know that they're all encouraging it as an option, but that is a individual school policy decision. But again, I just want to make it clear that we have recommended that along with our healthcare system, but again, individual school policy decision. In talking about schools, I think we all know that school is imperative to society. It's extremely important. I think we all know that there is a huge psychological component to the pandemic in general. Certainly for children to be away from other children, we need children to be in school. But the problem is that when community transmission is high, school transmission is going to be high. I definitely am concerned about these numbers as, we're headed back to school, and I have kids. My kids go to public school as well. And so, I feel for you because I also am concerned. I'm not near as concerned about children as I am concerned about staff, the people who care for the children, and immunocompromised children. Because, in general, children have a lesser illness, what we know right now. But they can still transmit to other people who are more susceptible or more at risk. And again, that can further transmission of disease into the community. And so I think, again, if we want to see kids back in school, and we do, they need to be in school, we've got to work on this community transmission issue because, when that is brought into the school, it's going to cause transmission inside the school. So I know all the schools are have options for, online learning or hybrid type of learning. And, I think it's going to be an individual decision that everyone has to make. And, I think people ask me all the time, what are you going to do? Well, I don't have an option. I can't teach my kids at home. I'm going to be here and doing this. And so, I think again, we need to expect that there's going to be cases in school, and we're going to mitigate those as much as possible and do contact tracing and quarantines and isolations. I do know that school-age children age 3 up to age 21 are going to be prioritized for contact tracing and investigation, and that's per an order from the Department of Health. There's probably a lot more I could say about schools, but I've got a couple other things that I need to talk about. I want to talk a little bit about DHSS. I have requested assistance from the Department of Health 2 weeks ago. Right now, they also do not have the capacity to provide that, and several other health departments are in the same boat. And so again, resources and capacity are low. So, talking about, this is kind of my last thing, and I'm going to try to go back through and hit these questions. Again, going back to the fact that, contact tracing and investigation is not going to be enough. We are losing capacity rapidly to investigate these diseases in a timely manner. And so I have two big things that I want to tell you. So number one is, when we call, please answer. That is probably going to come from a 431-1947 number. We have a couple of lines. Please answer, please call us back. I know there's been some people who have said, nobody's called me. Sometimes when we get stuff over on labs, it's the wrong number. It's a disconnected number. It's a number that doesn't have a voicemail. That puts us in a really hard position. So we will send a letter. So please call us back. If you are a positive case, so you've been told by your doctor, your lab, whatever, that you're positive, please self-isolate. Stay home. Don't wait for us to call to tell you to stay home. Stay home, stay away from others, isolate in your home if you can, and monitor your symptoms. Watch for those emergency warning signs: shortness of breath, difficulty, any kind of difficulty breathing, chest pain, feeling confused, blue lips. Those things are emergency warning signs and really need to get to the emergency room. So we would ask you to self-isolate if you have been named a positive case and that's been communicated from your doctor. Quarantine. So remember, isolation is for people who are cases, quarantine is for people who are contacts. If you have a friend or somebody you know who has called you and said, hey, I'm a positive case. I think you are maybe exposed. Please self-quarantine. Again, don't wait for the health department to call you. We've gotten into some recent situations where, people are out, they've been tested, they're symptomatic, and they're, they're continuing to move about in the community, even though they're symptomatic, they've been tested. Please, if you're being tested for COVID-19, and again, if you're symptomatic, stay home. Wait until you get those results. And I know I'm saying some blanket things that make it sound like I think that's easy. I know it's not, because I know the struggles, to the best of my ability in the community with poverty, and we know that people need to work. There are legislative pieces, and I'm not in HR for a company, and so those are things that you would need to talk to your company about. But there is some legislation that is working to protect that. And so again, if you think that you've been exposed to COVID-19, we would ask you to self-quarantine in your home. Again, don't wait for us to call you, because it may be delayed several days. We're about 2.5 days behind on investigation. So again, those two things are really important. I'm going to continue posting that every day with our daily number update. I know that people have tried calling us. We're trying to get to the calls as soon as we can, messages as soon as we can. Our lines are busy. Our phone system is being overloaded. And again, we're doing the best we can. I'm going to try to go back through all these questions, and there are a lot, I think, or maybe it's just people joining. Can you provide guidelines on weddings? So the guidelines fit into the buckets of social distancing, masks, and disinfection, and staying home when you're sick. So those are the buckets. So you need to social distance. Everybody needs to stay 6 feet away. If they can't do that, they need to wear a mask. Need to have some type of way to sanitize things, provide hand sanitizer, and you need to encourage folks to stay home if they're sick. I realize those are kind of general, but that's the buckets that they fit into. And so that's what we would suggest. There's a lot more to unpack in that. Some of it's a little bit of strategy, but they fit into those buckets. I see some questions about stay at home. I think, we need to be careful about that. I think the better option is that everyone wears a mask to prevent that from happening. Right now, healthcare system is okay. We're seeing an increase, but, they're doing all right. They're not in the point where they're having to provide crisis surge type of care. And so, again, I don't think that we're there at this point, and I hope we never get there. But, wearing a mask can help prevent that. Okay, there's a long one here. I'm just trying to read it. I have a huge question. I went to get tested yesterday for COVID, and they asked me if I wanted the blood test or the nose swab. I said, of course. The blood test only takes 10 minutes, but they didn't tell me that it's only for antibodies, and the nose swab will tell you if you're basically actually infected or not. Spent some money for nothing, and now I'm upset. So we've talked about this several times, but the antibody test is not to be used as a diagnostic tool. It should not be used for people who are sick, for sure. So, again, that's not recommended to be used as a diagnostic tool to diagnose an active infection. And so, we really support the use of the PCR test. That's the nasal swab. Great Minds is using an antigen test that's a swab. And that is very similar to like a strep swab, or a strep swab. And then they are sending that off for confirmation with a PCR. And so again, the antibody test is not recommended for diagnostic use. Scrolling through. Some of these I think I already talked about. When do you call people with positives? So again, I think we already kind of talked about that. The goal is to call within 24 hours of us receiving it. So the lab or doctor's office has 24 hours to report it to DHSS. So DHSS is reports that they are sending those to us within a few hours when they get them. And so the goal is 24 hours for positives. But again, at this point, we are beyond that by a couple days. Yeah, so there's a couple people asking about a couple questions about like outbreaks in individual places or entities. A couple of things, I'm way over on time, and I got to hop off here in a minute, and I'm sorry, I've got to get this media call ready. But there's a couple of things. So at this point, this is so widespread that making an announcement every single time there's an outbreak in a place is really not helpful. Because there are multiple places that have a few cases or things we're investigating. And so every interaction with another person that is outside of your house should be treated as a risk. We are seeing active community transmission. It is here, it is happening, and we need to take the steps to prevent transmission and decrease those numbers. And basically, essentially, we're back to flattening the curve because the curve is going up very steeply. So yes, there are cases in congregate facilities in the area, and the people who are contacts in those areas are aware of that. So trying to get through here. I'm not seeing. Some of the questions are questions I've already said. Yeah. Some of the questions are just about, our jurisdiction and what we can do. And again, I think we have been giving mitigation recommendations for several months now, most of which haven't changed much outside of, stay-at-homes and things like that. So the recommendations are still the same. And, unfortunately, again, it's become political. And unfortunately, the longer it takes for us to all get on board and start working together is really the better words to use, the longer it's going to take to control this. And anything that we start today, we're not going to see the fruits of for another 4 weeks. So, it's important. I'm trying to scroll through here. There's just so much that is coming in. Yeah, so someone's asking about some questions about how cases are counted. So the cases that you're seeing that are counted are mostly PCR. You can see in kind of the original spreadsheet that everybody really liked, that you can see the number by PCR, that's a confirmatory test. You can see the number by serologic testing, that's antibody testing. That is not a confirmatory test, that's what they call probable test. And then you can see EpiLink, and EpiLink usually means it's a household contact that didn't get tested but is symptomatic in the same incubation period. So looks like a duck, sounds like a duck, it's COVID-19, okay? So you can see very little cases have been counted as what we would call probable cases, the antibody and EpiLink, because we try to get our household contacts to go get tested. So what I would say is, again, if the ones that are PCR, most of these tests or these cases, they are counted because they are a PCR confirmatory test. It's not enough, if a doctor sent us over a note that says, this person had symptoms, but, we didn't test them, they're COVID-19. That doesn't get counted, and that doesn't happen. But, I think there's this thought that maybe that's how things are happening. That's not how it happens. We have to have a confirmatory lab for us to investigate and to count it as a case, unless they have some of these connections, like an EpiLink. Again, if somebody called me and I'm sick, had my PCR, and I say, yeah, my husband got sick yesterday, we would tell them, we really think your husband should get tested. Here's some testing sites, but if he doesn't want to get tested and his symptoms match, COVID symptoms, they have to have a number of those symptoms and then be connected, we're going to count them. And I know that sounds a little bit confusing, but this is how we also conduct other investigations for other diseases. But I think it's less than 20 that are antibody tests or epi-link tests, because if we get a positive antibody in somebody that's sick, we also refer them for PCR. What about funding? I've heard, yeah. So that funding did not come to the health department. That came to county level government. And so we're still waiting on that. I'm trying to get through here. I've got to hop off. I see a lot of questions about, should I send my kids? There are online options. I see somebody else talking about that. There's also, I can't believe Facebook hasn't kicked me off here. It's been going on for way too long, a very long time. There's also a sheet that we had posted last time about basically, kind of a self-assessment, because it's an individual decision. It is. I think you have to think about what your risk is, or what the risk is to your family as far as, medical conditions that put us in high risk categories. And so CDC has a good tool for that. I'll post that again. I'm trying to get through here. I see a question about access to online classes. I think, reaching out to the school is a good idea on that if you don't have access for online classes, because I know there were some things that they were working on that were like grant funding dollars or CARES funding to be able to assist in that way. So I would definitely suggest reaching out to your school district. Again, I see some questions that, again, reaching out to, elected officials and, talking with them about things that you're wanting to advocate for would be the next step there. I see some question about also surfaces. So a couple of things on that. The primary way that SARS-CoV-2, the virus that causes COVID-19, the primary way that is spread is person to person. So that means, within 6 feet of someone, talking, singing, laughing, sneezing, coughing. It is respiratory droplets landing in that person's mouth, nose, and infecting them. Surfaces it's possible, but to a much lower degree. If I had to choose between masks and disinfecting surfaces, I'd choose masks every time. That doesn't mean you shouldn't disinfect surfaces, you should, but I kind of hear that a lot as we're going to do this, but not that thing. If I had to pick, it's masks every time and social distancing. So, okay, I'm so sorry. I've got to hop off here. I've been on for a super long time. Thank you for everything you're doing. All of this stuff that I say here, this is not to scare people, to cause panic, any of that. That's not it. I think that's a very bad way to respond to this pandemic. I think being realistic about what's happening is important. And I try to give you guys everything that we can give as far as information. We have to be careful about identifying people. But I think it's pretty clear that numbers are going up and up and up. I would like to get to the point where, we either do updates, Monday, Wednesday, Friday, or do a weekly update with a good trend analysis. I know I saw some people asking for graphs. I look at like several graphs every day. And data every day, and I'd like to be able to do maybe a weekly report. Again, right now capacity is low, and I think some of it will be a little bit of a trade-off if we go to a weekly report, that we don't do so much of the daily stuff. And those are just things that I'm thinking about. Community status indicator is important. That is, does look at the data and then also uses the national guidelines. And again, those are guidelines and recommendations. They are not mandates. And those are from the White House Pandemic Task Force that they suggested that everyone use. So again, I think, being realistic is important here. I appreciate everything that people are doing and trying to move in the right direction. I am concerned about the numbers because, the more we have, the more we're going to get. Because, the reproductive factor for COVID is like 2 to 3 persons. So that means one case is going to infect 2 to 3 more people. And some of that depends on exposures and areas and that type of thing. But, so you can see the exponential growth that is possible if we don't break the cycle of transmission. So again, it is imperative that we work to maximize our physical distance from others, wear a mask when we cannot do that, stay at home when we're sick, and of course disinfecting frequently used surfaces regularly. Those are the things we've got right now to respond to this. And so again, we appreciate all that you're doing. Please continue helping us in this. Because again, the health department's goal is to protect the health and safety of the citizens. And, unfortunately our capacity is limited, and we're doing as much as we can. So I'm so sorry that I'm way over on this, but, I know we had a lot to talk about. So, we'll update numbers at 4, and, watch out for, our media update, with Dr. Kirkley and local media. So thank you very much.